The long-standing argument of whether public representatives should be using private sector facilities if their constituents only have access to state facilities that are often not up to standard has again reared its head. Equally, the compulsory membership of PARMED has also been a contentious issue among MPs for several years now.
PARMED serves people that have been in Parliament for far longer that have retired, and it is the new members that sustain it. We need to have a choice to pledge solidarity with the people of South Africa. Remember, if we do not use public healthcare services, there is no way that they are going to provide quality care. In ActionSA, we are expected as office bearers to use public services.
This is also in an effort to encourage more public representatives to use public healthcare facilities.
Now, parliamentarians have a choice to stay in PARMED, to join another medical aid, or to not be in a medical aid. This is a critical first step to ensure that necessary health reforms occur. If we say it is a national health insurance, the first person in there should be the head of state, his deputy, his cabinet, and all members of parliament, judges, and members of the provincial legislature.
Some of the chief whips at Parliament have expressed their views about this amendment bill.
So I know that the debate it's going on in terms of members choosing their own medical aid, but that should not be conflated with encouraging people to use public healthcare facilities. We need to do that. We need to encourage people to use public healthcare facilities. We don't believe that it must be forced on all on everyone to only use public healthcare facilities. I think we need to also respect the freedom of choices that people have.
As far as the public healthcare is concerned, its failure and the fact that it is failing millions of South Africans daily is a glaring shame, and one that should be laid in its entirety at the ANC's door. But it will not be rectified by forcing members of the legislative authority to make use of it. It will simply put more strain on the system.
The IFP therefore supports the call for PARMED to be non-compulsory, so that MPs can decide on the medical scheme best suited to their circumstances. Importantly, this debate must also push us as public representatives to strengthen and improve the public healthcare system that millions of South Africans rely on daily.
The ANC said it's gathering more information on this matter, while the DA said its caucus had not yet discussed it. Zelene Merrington, SABC News, Parliament.